everybody. My name is Lidia SOUSA. I'm a psychiatrist working in a Portuguese General Hospital and also a PhD student at the Faculty of Medicine of Porto University and a researcher at the Center for Health Technology and Services Research. Today I'm here to briefly present the preliminary results of part of my PhD project, which consisted in developing and feasibility testing a music-based intervention for people living with dementia during acute hospitalization. First, I'd like to briefly contextualize the problem. We all know that dementia is a major healthcare concern worldwide with an increasing prevalence and that is estimated to continue growing. But what might be less well known is the dementia burden in acute general hospitalizations, with recent estimates pointing out that around a quarter of all acute hospital beds are permanently occupied by people living with dementia. The management of people living with dementia in the acute setting is particularly challenging since behavior and psychological symptoms of dementia and particularly agitation arise frequently. Sedatives and physical restraint are used frequently, despite the lack of effectivity and the associated secondary effects like acute cardiovascular events. Non-pharmacological interventions are widely recommended by the main international guidelines for dementia care, but they are hard to implement in real life. There has been a growing interest on the use of music therapy and other music-based interventions with therapeutic aims in dementia care, with many studies indicating positive effects in mood and behavior. But there are very few studies conducted in the acute setting evaluating those interventions. Thus, the primary objective of this project is to develop a protocol for administration of a music-based intervention to patients with dementia in the acute hospital setting and to assess its feasibility. We expect to find evidence supporting the hypothesis that the use of music-based interventions during acute hospitalization is feasible and brings positive effects to the patients with dementia, namely by decreasing agitation and other behavior and psychological symptoms of dementia. The project is divided in 4 stages with independent recruitment for each of them. To inform the MBI protocol development, we started by surveying the literature, patients with dementia and hospital staff about what is viable and acceptable. A systematic review was carried out, including all identified studies evaluating the administration of music-based interventions to people living with dementia in the acute setting, regardless of the outcomes of interest. Additionally, a scoping review was conducted to map out all MBI that have been administered to people living with dementia with the goal of managing behavior and psychological symptoms of dementia, independently of the setting. Following that, we performed a qualitative study where we used semi-structured interviews to scope the views of people living with dementia and their carers and of healthcare professionals working in acute hospital setting regarding what is acceptable and desirable in a music-based intervention conducted in the acute setting. The information gathered in the steps described before was collated into an evidence-based protocol for a music-based intervention through consultation of experts in dementia care and music therapy. Finally, a pilot feasibility trial was planned, taking place in a Portuguese General Hospital. The main conclusions of the scoping review were that it was not possible to identify any evidence-based protocol to administer music-based interventions to patients with dementia in the acute setting. But still there was evidence suggesting that positive effects might come from those interventions regarding well-being, mood, cognitive function, and reduction of behavior and psychological symptoms of dementia. Importantly, regional and cultural variations might have a great impact in the effectivity and the feasibility of such interventions, and thus should be carefully considered when planning a protocol for a music-based intervention. No ideal frequency, duration, or dose and other logistic details were identified, but individualization to the patients and training of the person delivering the intervention in dementia care seemed to be very relevant. Regarding the scoping review, we identified more than 100 studies that investigated the use of music-based interventions with patients with dementia with the goal of altering, managing, or preventing behavior and psychological symptoms of dementia. The best conclusions that we can draw from the available evidence is that a successful intervention would happen at least once a week for no less than 30 minutes and under the direction of someone with at least some training in dementia care. And it should be tailored to the preferences of the participants. The possibility of negative effects must not be overlooked, and this should be identified promptly. Importantly, available evidence also indicates that it is possible to deliver music-based intervention to people living with dementia with positive effects, even without directly involving a music therapist. The qualitative study consisted in semi-structured interviews with people living with dementia and their carers, as well as healthcare professionals, regarding the willingness and acceptability of music-based interventions in the acute setting. The healthcare professionals consider that the music-based intervention would be beneficial both for the people living with dementia and for the staff in the hospital, though some logistic constraints could difficult the implementation. It was considered that if staff is motivated and cognitively engaged, it is possible to introduce the MBI in this setting. Overall, people living with dementia and their carers expressed the opinion that an MBI during hospital admission would be desirable and produce positive effects. Preferred music listening on an on-demand basis with the possibility of refusing or stopping early intervention was mainly stated. In future studies, it would be important to use bigger samples and to promote discussion of ideas in focus groups involving other relevant stakeholders like hospital and clinical managers and healthcare policymakers. The final MBI protocol that we derived consists of a semi-individualized music listening activity that takes place at bedside of the patient in the acute hospital setting and is delivered by a healthcare professional that has at least some training in dementia care. The duration is of 30 minutes, taking place bi-weekly. 5 playlists are available from which the patient could choose from. Classical music, popular Portuguese music, music from the 60s or 80s, traditional Portuguese music or folklore, fado, and religious musics were selected based on the participants' preferences. An MP3 device and headphones or small portable loudspeakers are supposed to be used to deliver the music. We produced a feasible, acceptable, and evidence-based method for delivering MBI. Currently, this is being piloted in a Portuguese General Hospital, and we hope to have preliminary results for implementability and effectivity soon. Thanks for your attention. I have here my contact should you have any other questions regarding the project. Thank you.